Every other day we hear of somebody collapsing to sudden death. Famous people, you know the names,
Yes.
unfortunate, and many times they are young people. The only way is to treat them when they have collapsed. So by the time the person reaches the hospital, the usually declaration is dead on arrival. A person who is collapsed should not be shifted to a hospital. At that spot, you are the doctor and that spot is the hospital. You outstretch your hands as we showed you, elbows straight, fingers outstretched of one hand, and with the heel of the hand, you press the sternum 100 times a minute, 2 inches deep. This is the way you are going to keep the brain alive. With the shock, the patient, if the heart has started beating, will open his eyes, will move a little. Your job is done. You have given life to a patient.
Namaste everyone, I'm Sana. I'm a certified yoga therapist and I wanted to start this series of health and lifestyle. And the first guest we have here today is Dr. Akshay Mehta. Dr. Mehta is an interventional cardiologist with 35 plus years of experience running his own clinic in Juhu. He's also associated with Breach Candy Hospital, Nanavati Max Super Specialty Hospital, as well as Holy Family Hospital and many more. He's a member of various prestigious organizations, the Cardiology Society of India, American College of Cardiology, American Heart Association, and the European Society of Cardiology, amongst many others. And he has authored several books, one of which is right here with us, Romancing the Heart. And it has received a lot of acclaim from luminaries such as Sister B.K. Shivani, Sri Amitabh Bachchan, Sri Sunil Gavaskar, and Dr. Devi Shetty, amongst many others. His patients always praise his pragmatic approach because they can really lay their trust in him and his hands. And it's his health first approach here that is encouraging us to take the responsibility of our own health into our hands rather than just relying on external sources. So, sir, we are honored to have you here for our first podcast.
Thank you very much, Sana.
And there are several things which we want to ask you. But first, I would like to start with the most important, that is CPR, something that you have initiated as the president of the Rotary Club of Bombay Airport. You have installed AED machines at 63 high traffic railway stations in Mumbai and along with training the railway staff for CPR. I would really appreciate if you could teach us a little bit about CPR and about how AED machines can be used and tell us a little about how you started this journey of installing these machines, of training the staff. What encouraged you?
Thank you, Sana. Every other day we hear of somebody collapsing to sudden death. And this makes newspaper headlines because those people are famous people. You know the names.
Yes.
Unfortunate. But besides them, there are so many others who are unknown people who die on the road, at homes, in the gyms, etc. And many times they are young people. And it is difficult to prevent these deaths because they are healthy. They don't go for checkups. They feel fine. They look healthy. So, what do? The only way is to treat them when they have collapsed. One of the, out of ignorance, one of the mistakes that people do when somebody collapses is that out of fear, the first thing they do is rush him to a hospital. Unless the hospital is very close by, say 1 or 2 minutes away, or unless they can do CPR on the way, a person who is collapsed should not be shifted to a hospital. That is not the first thing a person should do. And that is the mistake people do. Because in cardiac arrest, what happens? That the heart, which is normally pumping, suddenly stops pumping. So when it stops pumping, the circulation of the blood stops. Blood flow to all the organs of the body has stopped. And the organ which suffers the most or the earliest is the brain. If the brain does not get blood in 5 to 7 minutes, it gets irreversibly damaged or even dies. So if somebody has a collapse somewhere, say on the road or in an office or at home, if you are going to take that person on a stretcher, on a chair, or in whatever way, take him down to the taxi or to the car or to the ambulance, in those 5 to 7 minutes, the heart has stopped, the brain is not getting blood supply, it results in brain death. So by the time the person reaches the hospital, the usually declaration is dead on arrival. So the mistake people make is to shift the patient to a hospital in case of cardiac arrest. So when a person has cardiac arrest, the first thing should be to do something so that the brain remains alive. So now, how to recognize cardiac arrest? So there are 3 signs for cardiac arrest. One is a witnessed collapse. That means you or your friend or your colleague has seen somebody collapsing. A person is standing or reading or talking in a meeting and suddenly collapses. So that is the first sign. The second sign is you tap both the shoulders very firmly and shout loudly what has happened to you. If that person doesn't respond, that is the second sign. And the third sign is watch for breathing. That means you look at the abdomen and the chest and see if it is rising or falling, or keep your hand at the person's upper abdomen and see if it is rising or falling. If that doesn't happen and the person is not breathing, it means it is cardiac arrest.
Oh.
Or sometimes they have abnormal, what is known as agonal breathing. That means they have that kind of breathing. So that is agonal. So that is also abnormal breathing. That is also a sign of cardiac arrest. So there are 3 signs of cardiac arrest: sudden collapse, which is witnessed by you or by your colleague. Second is no response on tapping the shoulders or shouting. And the third is no breathing. So these are the 3 vital signs. Now the fourth is, if you know how to take the pulse, you can spend a few seconds, but don't waste too much time on noting the pulse. Because many times you don't know where the pulse is. So these 3 signs are most important. So once these 3 signs are there, it means the person has cardiac arrest. And now your work starts, because at that spot you are the doctor and that spot is the hospital. You don't waste time in shifting, because if you waste time, the brain will be dead. So now the action starts. So recognition, I told you 3 steps. Now the action also has 3 steps. And what are those 3 steps? Number 1 is call for help. When a person has collapsed, you make the person lie down on a firm surface at a safe place. That is the first thing you do. And then you call for help. The help is needed. Why help is needed? Because you want somebody to call up the cardiac ambulance. You want somebody to help you while doing CPR. You want somebody to get the AED machine. Supposing this is an office building and you have an AED machine on the 1st floor and you are on the 6th floor. You must tell somebody, rush and get the AED machine.
Right.
So for these reasons, help is required. So the first step, once you diagnose a cardiac arrest, is to call for help. Right? Now the second thing, the second step is to start CPR. Because your CPR is going to keep the brain alive. And doing the CPR properly and learning it to do properly is very important. For that, what we do is we press the chest of the person on the breastbone. Now, how to check where the breastbone is? If you put your hand at your navel and go up, it is the stomach, which is a soft part. You should not compress there. But above the stomach, if you go in the midline, is the bone. That is called the breastbone or the sternum. And that has to be pressed 2 inches deep, 100 times a minute. That is the rhythm you go to. And that is what you have to do. And when you do that, your hands, your knees, and your body has to assume a certain position so that you can do it properly.
Right.
For example, the pressing has to be done from the ball of the hand, from the heel of the hand. And the hands have to be straight, fingers outstretched, elbow straight, no bending at the elbow. Elbow should be straight.
Okay.
Put the other hand on the top of the first hand and fold your fingers. That's right, exactly. And now your pushing has to be from the shoulders. So your upper body has to move, not the hand. The hand doesn't have to push. The whole body has to push.
Right.
So that way you can push 2 inches 100 times a minute, and you will get tired. So what you do is you tell the other person, okay, what I am doing, you do. मैं जो करता हूँ आप करिए. Turn by turn, everybody does that. So when this is done continuously, the brain gets blood, you are saving the brain. So that is the second step. We will show you in exactly with the mannequin how it is done. And the third step, when the AED machine comes or when the cardiac ambulance comes, they have a machine called a shock machine or AED, automated external defibrillator, which when applied to the chest, the machine diagnoses that this person requires a shock and it gives a shock, or it tells you to give a shock. And when the shock is given, the heart can again start beating properly and the person can be revived.
Okay.
With the first shock, the person may not be revived. In that case, the machine tells you continue CPR again. And after 2 minutes, the machine tells you, I'm going to give a shock, keep away from the patient, and the machine gives a shock. And then with the second shock, the person can revive.
Okay.
If with the second shock it doesn't get revived, again the machine will tell you start CPR. So it starts CPR. So do CPR for 2 minutes, the machine can give a shock after that and the person can get revived. So this cycle goes on, giving CPR and shock, giving CPR and shock. This cycle goes on till the person revives or till the cardiac ambulance comes.
Okay.
So this is how a person can be revived. So learning to recognize cardiac arrest is number one important thing. 3 steps: witnessed collapse, no response to tapping, and no breathing.
Right.
That is diagnosing cardiac arrest. And the 3 steps to revive a person. First is call for help. Second, start CPR. And third, use the machine.
Right.
Now there are additional points which I would like to mention.
Yes.
One is there is no need to do mouth-to-mouth breathing. With COVID and infections, it may be dangerous and you may hesitate to give. Nobody will like to give mouth-to-mouth to a stranger. And fortunately, scientifically it has been proven that if the response of doing CPR is fast, then mouth-to-mouth breathing doesn't help too much. Okay, so mouth-to-mouth breathing has got to be done. Second thing, many times the hesitation comes there will be a police problem. If I help a stranger and it doesn't get revived, police may ask me my whereabouts, they'll take my statement. Nothing of that sort. Because there is a good Samaritan law by the Supreme Court which says that if you are helping a person in good faith, then there will be no police involvement for you. Okay, so that also is not a problem, right? So these are the things. The third thing I want to tell you is while doing CPR, which I will show you, you may break ribs of the patient, but that also you should not worry about. Even if the ribs are broken, if the patient revives, that is a great thing.
Yes.
The ribs will heal themselves.
Right.
So these are the few things I want to tell you. Now, this what we described was cardiac arrest. Now, cardiac arrest is this and heart attack is something else. In heart attack, what happens is that I would like to show you from a picture
Yes.
that, heart is a muscular organ. Now, heart has 4 chambers, but I am showing you only 1 chamber. And this is the heart muscle, which contracts and pumps blood to send blood to the entire body through a large tube called the aorta, right? So, like every muscle in the body, the heart muscle also requires blood while it is pumping. And this blood is obtained by the heart muscle through the branches of the aorta called coronary arteries. These coronary arteries supply the heart muscle. And when these coronary arteries get blocked, the blood supply to a portion of the heart muscle stops, and that heart muscle, part of the heart muscle gets damaged, and that is called a heart attack. And the person gets chest pain. The heart is beating, the person is breathing, he's talking, he's saying, I'm having chest pain. The chest pain is moderate to start with, becomes more severe, lasts for more than 15 to 20 minutes, maybe some hours, and it's more like a heaviness or tightness or sometimes even burning. It makes the person so uncomfortable that he cannot breathe, and it occupies an area like the palm of your hand, maybe on the right side, on the left side, or the center, or the entire chest. It can spread to the jaws, to the neck, to the shoulders, to the arms, to the back. Sometimes the chest pain, the pain occurs not in the chest but only in the back or shoulders or jaws, which lasts for more than 10-15 minutes. So any pain which is unusual, which lasts for more than 10 to 15 minutes and which occurs anywhere from the navel to the jaws, anywhere the pain occurs, which is unusual for the first time occurring, which causes sweating, pallor of the skin, difficulty in breathing, such a pain, it is called a heart attack. And in a heart attack person, the most important thing is to send the person to the hospital or take the person to the hospital. Reach the hospital as fast as possible. And while going, tell the person to chew a tablet of chewable aspirin, like Disprin. He should chew the tablet in the mouth and swallow it while going to the hospital. So this is the response of a person to a person having chest pain or a heart attack. So in a heart attack, there is chest pain, go to the hospital. In cardiac arrest, there is collapse. Don't go to the hospital as the first step. As the first step is calling for help and doing CPR and using a machine and calling a cardiac ambulance. So the difference between cardiac arrest and heart attack should be noted.
Okay.
Right?
That's an important point to note, sir, because most of the times, because of misinformation, people tend to lose lives like this.
Correct.
So, yes, so I think heart attack and cardiac arrest you have explained. Could you also explain the different terms that people find confusing? There is angina, myocardial infarction, there is heart failure, the very fatal sounding heart failure, and of course, cardiac arrest. Could you just briefly tell us what is the difference?
So, let's talk about myocardial infarction. Myocardial infarction is the same thing as heart attack, which I explained by showing that diagram, that a portion of heart muscle gets damaged and gets dead also if the artery is not opened. That's why opening the artery is very important. That is why we urge the patient to reach the hospital as fast as possible. If the artery is opened within 1 hour of the chest pain, then the damage is prevented and the heart is as good as it was. So reaching the hospital in case of heart attack or myocardial infarction is very important. That is one thing. Angina is similar to heart attack, but as I said, a warning sign or one can say the trailer of a movie. It lasts for a few minutes, goes away. Many times it is recurrent or what we call stable angina. That means every time a person walks a certain distance, he gets discomfort. Or every time a person is excited, he gets discomfort. But as soon as he cools down or rests, the pain subsides. That is transient reversible pain. That is angina. Third thing is heart failure. Unfortunately, we have been using the word failure, which is very depressing and very kind of frightening to a patient. And my endeavor is to now suggest that the terminology should be changed. Instead of failure, we should call it maybe heart insufficiency. Because basically it is an insufficient heart. It has not failed. It is insufficient. That means it is not pumping to its full capacity or not able to receive blood. It has become so stiff that it is not receiving blood. In either of these conditions, whether it is very stiff and cannot receive blood or it cannot pump enough blood outside, what happens is there is a backlog of blood in the lungs. Those lungs give blood to the heart. And then the heart pumps out. If heart cannot pump out or it cannot accommodate blood because of stiffness, then it is called heart failure, but I would like to call it heart insufficiency, and that causes logging of blood in the lungs and that causes breathlessness. So breathlessness is a sign of so-called heart failure. The other signs are swelling of feet, fatigue. These are also other signs of heart failure. And such a patient can be treated with medications and sometimes with more invasive
Okay. So as you mentioned, swelling of feet, there is one technique in yoga where we are supposed to keep our legs up the wall to reverse the flow of blood to assist in venous blood flow towards the heart. So there are some misconceptions about which conditions it's good for and which ones it's harmful for. So can you just throw some light on that?
Yeah, I think this leg raising, relaxation, etc., is good for most people.
Okay.
The only people who should not do it is people who have heart failure or heart insufficiency. Those are the ones that better to avoid for them. And patients who have coronary artery disease,
Okay.
in them also too much of venous return or the return of blood to the heart may load the heart and cause problems.
Okay.
So
So
those people you do not, but other patients, other people can do
so
it.
even high blood pressure is not a
If it is under
contraindication.
well-controlled blood pressure, he can do it.
Okay. And somebody who's suffering from varicose veins,
Can do it.
that
Yeah,
it will
sure.
benefit them.
Yes, yes.
No restrictions for valvular defects or congenital
Again, if
defects.
valvular and congenital heart defects cause heart failure, then it should not be done.
Okay, great. So that I think explains about the different kinds of heart diseases.
Correct.
Now I think we can proceed to
Sure.
the demonstration of
Sure, sure.
CPR.
So now we can start with CPR demonstration. So the first thing that you have to do when somebody has collapsed, wherever he has collapsed, is to put him on a firm surface in a safe place. For example, a person has collapsed on the middle of the road, bring him to the side of the road. So safety first. Also, many times a person has collapsed on a soft bed in his house. So don't keep him on the soft bed, but bring him on the floor. After putting the person on a firm surface, do a little head up tilt so that the breathing may be better. If at all he starts breathing. That is number one. Number two is tap both the shoulders to find out if he responds. There is no response. And the third thing is you watch for breathing. If there is no breathing and no response, it means this is cardiac arrest. You have diagnosed a person having cardiac arrest. So now your action starts. And the first action is to call for help. And when you call for help, it means there are three things you do. You tell somebody to get the AED machine if it is nearby. AED machine is automated external defibrillator, which is a small handheld machine which can be carried. So this is kept at, if you have seen, they are kept at airports, and now we have put them on railway stations and they are available at many places. We are increasing their number. So tell somebody to get a AED machine. Second step is doing CPR, in which you kneel next to the patient, you outstretch your hands as we showed you, elbows straight, fingers outstretched of one hand, and with the heel of the hand, you press the sternum 100 times a minute, 2 inches deep. And if you can remember the song, you can do it at that rhythm. Elbow straight, elbow straight. Yeah, very good. 1, 2, 3, 4, 5, 6, 7. This is, thanks. This is the rhythm. Good. Okay. So this is the rhythm. This rhythm helps you to give the compressions 100 times a minute. And that is the rate at which you compress, and 2 inches deep. While doing it, you may break the ribs, it doesn't matter. So this is to continue. Tell other people to continue, because this is the way you are going to keep the brain alive. So this was the second step. And the third step is using the AED machine when it comes. So when the AED machine comes, one person continues CPR, you do CPR, the other person attaches these pads to the chest, bare chest of the person. Here, there are some lights which are found. So this light is for attaching the pads. Once the pads are attached, the machine gives up this light which tells you that stop CPR. Please be away, don't touch the patient. Because if you touch the patient and the machine is going to give a shock, you will get a shock. So this is the only few seconds when you don't touch the patient and the machine is going to give a shock. With the shock, the patient, if the heart has started beating, will open his eyes, will move a little. Your job is done. You have given life to a patient. In that case, you can now shift the patient to the hospital. If with the first shock, the person does not come alive, then the light number 3 comes on, which shows a figure which says now again do CPR. So again do CPR for 2 minutes, and after 2 minutes again this light will come that keep away, the machine is going to give a shock. So again the machine will give a shock and the person can come alive. If that doesn't happen, again you have to give CPR. So alternately, giving CPR and giving shock will go on till the person comes alive, or if the cardiac ambulance comes. So this is how the person can be revived. So 3 steps: call for help, do CPR, and use the machine. This is how we can revive a person.
So, sir, one more question.
Yes.
Is it recommended to give aspirin or dispirin or sorbitrate when somebody has gone through a cardiac arrest?
Well, Sana, if a person has cardiac arrest, one should not give anything. Okay. Aspirin and sorbitrate are important for people who have chest pain, who are alive, who can swallow. So, for example, sorbitrate or nitroglycerin, we usually advise them to be taken when a person has chest pain and if his blood pressure is known and normal or high. If the blood pressure is low, better to avoid sorbitrate. But for all patients of chest pain, unless he has allergy to aspirin, should be given chewable aspirin like dispirin while going to the hospital. So aspirin is very important, and I think one should keep soluble aspirin like dispirin at home and use it if there is chest pain.
And sorbitrate also, sir?
Sorbitrate also should be kept at home, and if there is chest pain, if blood pressure is okay, one can take it under the tongue.
Right. Okay.
Let it melt under the tongue.
Wonderful. Okay. Thank you for this information, sir.
Okay.
I think this is very important for us to remember in case of emergencies.
Thank you.